If you're like me, you're tired of using the NPRS pain scale. And so I'm proposing a better pain scale. And this is something that I've been thinking about a lot. And when I saw this pain scale come out of one of the running research magazines, I thought this summed it up so well. And while this is related to running, I think you can use this in your clinical practice for all types of physical pain. So the typical NPRS takes you from 0 to 10. Where are you at with your pain? And in my opinion, that scale, if you're looking at the graph on the video right now, that almost puts you in this non-responding niggle or a short-term injury standpoint already. And so what I like about this is that the running related one here takes you from running smooth to all the symptoms that you might feel all the way up to a severe injury. So let me orient you on the pain scale. If we're looking at the x-axis of it, you would have running smooth on one side of it. So if you look at the green column here, that's running smooth, where it's pain-free, no effect on their running, their body's feeling good, they're psychologically in a happy place. There's not a ton of, they need to keep doing their normal management. They need to make sure they're gradually building up endurance. Um, no physical therapist intervention or really nothing is required, all the way over to a career-ending injury, which would be a severe pain, something maybe where there's a cartilage deficit that they can't get over, and that person's looking at surgery. Because of this, on that higher pain scale level, they're frustrated. They're likely having some depression or feeling heavy anxiety because of this, because it's impacting their life significantly. So on one side, we have running smooth, and then we have a career-ending injury. What I love about the scale is that it gives you these different categories in between that we can work with in orthopedic or sports practice. So let's say someone comes in with a short-term injury. Well, as they're having pain there, and then they get back to running or they get back to squatting or some other type of weight training, we're likely going to see that short-term pain just act as a twinge for a little bit, or maybe they're just going to have some discomfort as they're getting out of that. So it gives you as a physical therapist or a trainer some sort of framework on where should they be at on a physical description, where should they be at psychologically, what should their management look like based on all these different criteria. So if you're tired of using the NPRS, the 0 to 10 pain scale, I've been using this and showing this to a lot of clients because it gives you so much more breadth of how to talk about pain and how to talk about injury. Specifically because their pain is so subjective and it's so elusive at times that it's not that if someone's having pain while running, it doesn't always mean that they're having pain in a different area of life. So if they're when you're having some sort of symptom that's probably not constant, it might be taking you out of your activity a little bit, but there's going to be this continuum where, okay, now we're out of the short-term injury, but we're getting into a more of a twinge, or it's just a niggle, which is a small amount of pain. You're aware that something is going on, but it's not a full-on pain injury. So learning how to differentiate what gets you from the state of pain sort of all the way to pain-free, and there's a lot that happens in the middle of that. This is a great graph to help you start talking with people on how to go through really a whole continuum of the injury spectrum. So I would recommend, I'm going to have the research citation in the article below. Feel free to click on it, download it, share it with patients to start talking about pain and using a little bit of a different pain scale.